Hello, I'm Dr. Augustin with Bayside Chiropractic and Rehab. And for our video today, we're going to talk a little bit about whiplash. What causes it, what you need to know about it, what you can do about it, and what happens if you don't do anything about it. Now, whiplash can happen for many different reasons, but what we're going to talk about is primarily a rear end car accident. In other words, if you've been rear ended by another car. The first thing we have to talk about is it doesn't require, I know in a lot of commercials and stuff, you think you have to get hit at 50 miles an hour to have whiplash. That's actually completely untrue. And how we explain that is, if you get hit by a car that weighs 5, 6, even more 1,000 pounds, basically energy's never lost, it's conserved. So the force of that collision is a lot more than getting hit by a bike at 40 miles an hour, if a biker could get up to 40 miles an hour. So we have to remember the weight of the vehicle. So you can get hurt at low speeds, less than 10 miles an hour. I would even argue between 2 and 5 miles an hour. We know because usually we do have car damage even at the lower speeds, but we know because the weight of the vehicles are so heavy. Second thing we have to know is what actually happens. The actual injury occurs in one 1,000th of a second. So basically, the minute you get this that fast after you get hit is when the actual injury or the worst part of the injury happens. And what happens is you have to imagine your head is usually not resting on the headrest, but your upper body is against the seat. So that first split second, the seat in your mid-back flattens out. It flattens out your mid-back spine, but your head continues to stay where it's at. So your mid-back is flattening out, pushing up on the neck, but your head is staying placed, plus your mid-back's moving forward. So what actually happens in your lower neck is an abnormal motion. So our motions, we can flex, extend, turn, bend. Those are our normal motions. What happens here is we get a shearing motion in our neck. Our neck isn't designed to shear. And that happens as blink of an eye fast, right after you get hit. When that happens, the main injuries are actually ligaments and discs in your neck. Now, after that split second where you have most of your injury, then you go forward and back. Now that can cause the muscle injuries and the, what they call your less severe injuries, just to the muscle tissue. But we have to remember that first 1/1000th of a second. So what happens? You get in an accident, you have to recognize the symptoms. Now you're at the accident scene. You just bought a brand new $50,000 car, $20,000 car. You got a brand new car. You are very anxious. Your natural, all your stimulants, your epinephrine, everything goes up. Your natural painkillers. The last thing you're thinking about is pain. Your body's got your system. All you're doing is stressing out. So you don't really feel anything at that point. It might take you a day or two to actually start feeling symptoms, and that's okay. That's not abnormal because of all the chemicals in your body that are trying to deal with the stress. Now, what are the symptoms you're going to notice? Well, one thing you can notice is neck pain. You could notice severe neck stiffness. You could notice more than just neck stiffness. You have problems moving your neck at all. Some other symptoms that are early signs, headaches. You never really suffered from headaches. Now you're getting these headaches frequently. Jaw pain would be another one. Or dizziness, because your neck and your head has a lot to do with balance. So if things are stiff and tight and you've had an injury, you might get dizzy. That might be your first symptom. So what do? You end up going to an urgent care emergency room and you get x-rays. Well, here's the problem. X-rays can show you sometimes some muscle spasms because it'll show you that the neck, you have this nice curve in your neck. And when the muscle spasm, the curve straightens out and your neck leans forward. So that's what you see. But here's the problem with x-rays. I'd say 99.9% of all whiplash cases will not cause your bones to be broken and will not cause full dislocations of your vertebra. Or you wouldn't make it from that accident without an ambulance. So the x-ray isn't really a good diagnostic tool. It doesn't really show you what's going on. Your x-ray comes out fine. They say, oh, you're fine. You got whiplash. They send you home with muscle relaxants, some painkillers and stuff, and some, muscle relaxants, painkillers, and anti-inflammatories. Here's the problem. None of that treats the injury. Absolutely none of it. It treats the inflammation a little bit. It doesn't deal with any of the injury, which could be ligament, joint, and disc. So, what do? Well, I would hope you'd come or see a local chiropractor or come to the office and get checked out. Because a lot of these injuries can be detected without super expensive testing. You can tell if a joint's unstable. You can tell if a joint's hurting by just doing range of motion and passive range of motion. So you come in and you can't move your neck. So what do you do about it? Well, here's the things that you need to be aware of. The actual treatment for this deals with, first you got to do something about the pain. Nobody likes pain. So you have some therapies that deal with pain. Just like it's okay to take your anti-inflammatories. It's okay to use a muscle relaxer now and then. That's fine. But we also have therapies we can do that deals with the pain and also the swelling. Here's what you need not to do. Thinking that a narcotic is going to fix anything. It doesn't even act on the area, it acts on your brain. Even emergency rooms are getting out of the habit of prescribing narcotics because it's too dangerous to get hooked on. So that's one of the worst things you can do because it does absolutely nothing. So we deal with the pain, you start getting better. So what do we deal with next? Well, range of motion. We want to get your neck moving properly again. That's one of the most important things because something that doesn't move, it's like a tire on your car that sits and you have this expensive car and it just sits in the garage and you don't ever drive it. The tire dry rots. Well, if your neck stops moving and the joints stop moving, your neck degenerates. Joints without movement degenerate. We know that. So we try to get all the joints moving again. We do that with range of motion exercises. Very important in adjusting because with range of motion, you can only get so far. You can't get into the space. It's called the paraphysiological space, and it actually provides increased motion in your joint, and that has to be working right, or your muscles tighten up and you lose range of motion again. So we have range of motion exercises. We have mobilization. We have traction of the neck to help with the disc. If you had a disc injury or some kind of disc thing, it helps rehydrate the disc. It decompresses the discs in the joints. We have cold laser, which helps speed up soft tissue injury healing and also helps prevent scar tissue. Then you do rehab exercises. Once you can get your neck motioning right, once the pain's gone, once the compression's less, once your disc symptoms are lessening with stabilization exercises. Then we can go to active type exercises or strengthening. You want to strengthen the neck to provide stability again on the neck, and that way you undo the risk of further injury to the neck. Now, what happens if you do not do this and you just take the anti-inflammatories and you have some nagging neck pain and it never really goes away, you continue with the headaches? What they've seen is if you take x-rays right after the accident and nothing's showing, take them 6 months, 12 months, at about 18 months, and you've done nothing to improve these things, your neck starts degenerating. They have all kinds of names for it. Degenerative joint disease, degenerative disc disease, osteoarthritis of the neck. And what's real interesting with this is it's isolated. Whiplash usually occurs at the vertebrae from C4 down in the neck, and it can happen at C4, 5 in one level. So you see this degeneration in one level. So you get this patient that comes in 4 or 5 years later, arthritis at one level. The rest of the neck looks good. And you're thinking, that's not normal. That's usually because of a whiplash type injury. What happens after that? Disc problems, pain down your arm, chronic neck pain, even disc surgeries, fusions. So it's very important that you get treated for this. And it doesn't have to hurt the second you had the accident. It can take a few days, mainly because of the way our bodies handle stress with the chemicals we release. So if you have any questions, please don't hesitate to call my office. If you've been in whiplash and are suffering from these things, please call the office and get checked out. My number again is 251-990-8388, and we'd be more than happy to answer any of your questions. Thank you.